Hello, welcome back to my channel. This is the Chronicle with Lottie Arala. I am bearing it all, taking you through the journey through my health challenges, family and relationship dynamics, faith journey, and so much more as the Lord will have me share. Over the past few weeks before the Christmas and the New Year holiday, I started to take you through the journey of the breast cancer diagnosis 2 years ago, and I'm still recounting what has happened in 2023. And the last thing that I said about was the treatment, which was the first, and the surgery, the 13-hour long surgery. Ooh, the thought of that is still as vivid as yesterday, because it was a very, very difficult time. It was very difficult. I have a very high pain threshold, okay? And this is a person who gave birth with just paracetamol as a pain relief. And not underestimating in any way the pain of labor, but the kind of pain that I went through during the recovery from the surgery just makes labor pain seem very, very pleasurable. I'm telling you, this pain I cannot describe, is indescribable. And this is the pain that that following the surgery. The surgery was in different sides, so the breast and other parts of my body where they got the tissue from to reconstruct the breast. In the healing process, I had to start really learning to walk again, talking. Any movement sends the pain from my head to my toe into my nerves and bone marrow. And I was told it was going to be difficult. It was going to be a difficult recovery as well. But they just say difficult. Nobody really gives you the intricacy, the details. Maybe, I don't know if they're just doing that on purpose so that you're not too scared before you actually go through it. Yes, you might ask, oh, how about pain relief and all of that? Of course, I wasn't. I don't like tablets. I don't like taking medication. In fact, I'd rather just like not take medication than take medication. I'm so bad. Coming from a health professional, yes, we are the worst patients. I know, I've heard of that a lot of times. But I had to take pain relief. I had to take really strong opioids and pain relief. That's all things like gabapentin, pregabalin, morphine. Nothing was really touching it. And so I had to deal with that for a very long time. I couldn't getting up from the lying position. I have to be helped. Walking to any place, to the toilet, I have to be helped. Getting back into bed, I had to be. I felt so completely, totally useless. And for someone who has very young children, it was very difficult. A lot of it was difficult for me in a lot of ways. Apart from the physical pain that I felt a lot of emotional pain as well, because watching my children, they are very young. Like, I couldn't even pick them up, I couldn't even hold them to hug them, because nothing, absolutely nothing, can even touch the area where the surgery was done. And this was for several weeks. Well, as the weeks progressed, I was able to do more and more. So but when I came back from the hospital, first of all, I couldn't sleep in my bed, so I had to I have to have another place prepared for me where I would sleep, with a lot of paddings and pillows, just to be able to get comfortable, and also to be able to get up with well, not with ease, but without much stress. I have to get up a certain way, I have to sit back down in a certain way, I cannot lay a certain way. And that was my best lying down position, laying on my tummy. And I can't lay on my front side for weeks. Boy, like, going to sleep was not pleasurable anymore, because it's either the pain is waking me up or the discomfort was waking me up. It was terrible. But the emotional pain that I was talking about again was the fact that I'm a caregiver, okay? I love to give care to people. I have never really been in a position to receive care and to be so dependent on people. So that was really hard for me, feeling like I can't do anything for myself, like my whole independence was taken away from me. I don't really understand it, you know, when in the course of my job I see like old people and we are wondering why is it that they're not accepting help, why don't they want to accept help. Now I get it, because taking away your independence is something that it's not okay, it's not good, like it's not a good feeling. And I was there at that point. I couldn't do anything for myself nor for the people that I care about. I think even like the physical pain could not compare to that part of distress and pain that came with it. So, but you know, as the week went by, by the 6th week, I was able to get up by myself. I was able to get back. I still do need like support to get comfortable once I'm laid down. I could hold my children. I couldn't still hug them, but at least they could come near, close to me, and stuff. But what I really wanted to talk about today, apart from this pain, I can't even finish describing the pain. It probably would take like 3 4 videos to describe, but I'm not about to do that. I do really want to address something very important in this, which is mostly overlooked, unfortunately. And what I'm talking about is, you know, when someone is going through challenges, when someone, the patient itself, the whole attention and focus is usually on the patient. But I want to address a special group of people, the caregivers. The caregivers, whoever is a caregiver, whoever is a carer for their loved one who is going through a difficult challenge, they do need to be looked after as much as the person going through it. Because although I take, for example, my husband, when I was going through that stuff, right, he was doing everything possible. There's that, there are the children to look after, there's now me to look after, there is his work to go to, and a lot of other things that he has to do, and this is one person. So looking back and thinking, how was he able to hold it together? And of course I know that the diagnosis of cancer, as much as it weighed on me, did weigh on him as well. Only God knows the amount of fear and uncertainty that he would have faced, this physical and psychological stress, the physical and psychological stress. Should I say that again? The physical and the psychological stress that he had gone through. Not probably, because I do know, I did watch him. He's not very expressive, just like talking about his emotions and things that bother him, but I could read through it, I could see it, you know. So there isn't a lot of help out there for people who are actually doing this care day in and day out, their mental health, their physical health. Thank goodness. It's a big testimony, because he did not break down in spite of all of this. Because just imagine that, for example, he broke down physically, like he was so stressed that he couldn't carry on. What would have happened to me? What would have happened to the kids? What would have happened to everything? And yeah, that is one of the testimonies for me in that period, that he was there, he was hanging strong. And I did not make things easy for him, particularly because, again, like I said, I'm not one to sit down and be looked after. And I have to, like, I'm always on the go, like, get things done, just go get things done. And again, I have my ways of doing things. I can do 10 things in one go, because zap in my head, I've already finished doing it up here before whatever it's been seen in the physical has already been completed here. So at the time that this pain and the whole recovery process was going on, this is not affected. Like, my head is still doing stuff, but my physical body cannot get up to do it. And guess what? Of course, I wanted my husband to move in the same pace that I would, forgetting that he's a man, I'm a woman. Men are not blessed with that kind of stuff. And then also, again, I bite myself when I think about it, because things that needs to be done. It's not like he get things done, he gets it done. But my problem at the time was that he wasn't doing it in the pace that I wanted, or in the order. I know, yeah, if you frown at that, it's okay. I frown at it myself. But the order at which he was doing it was not something I was very welcoming to. So that put a lot of stress on me, on him. I'm like, I shouldn't even be causing an extra stress because of this person. And now looking back, I see these things as petty. I'll give an example of, like the household, the cleaning, household stuff, what kind of food the kids would eat and when they would eat it. And that the kids were well looked after, they were well fed. But what was I going on about again at that time? I don't know. This is part of the things, that this is a part of the dynamics, and I thank God, because if not for his grace, that alone is enough to put a long strain in my relationship, coupled with the strain already that he was having from the health challenges. So looking back now, yes, there has been a lot of growth in that aspect. Hallelujah. And we're still growing, as a couple, and in very various different kind of ways. But not that I'm digressing, I'm actually not digressing. Everything that I'm talking about in that season is very important. So if you are the one going through a challenge, just, if nobody is a superhero, allow yourself to be taken care of. If you have people around you, just let go. Nothing was spoiled. The house didn't get burned. Everyone was still breathing. Like, just quit it. Let things go. Things the way that you want things to be done, the time and the pace at which you want things to be. None of those things are really important. Okay. Yeah, I'm just talking to myself at this point, but if that applies to you, just know that so long as the day comes and it ends and everybody's breathing, that is a great thing, and that is a huge testimony. So just let the way that you're meant to do things, let it go. When you're able to do it again, of course, go back to the way you do things, but let the person that's looking after you breathe. Give them less stress. And for you who are the carer, I don't know what part of the country might be watching with this from, but I would suggest that you strongly, actively seek out support. Okay, seek out support. To help with things. Do not bear the burden by yourself. Do not carry on the whole household activities. And also, if it's maybe your partner or somebody that you might not be able to express how you're feeling to that person, because of course you're considerate to how the person themselves are feeling and all of the pain. But if you have someone who you can't speak to, honestly, it's good to let out things. Good to let out things. We were lucky. Not a lot of people are lucky. So people, just from the stress and the weight of everything, crash. And if you crash, then what happens? What happens to you? What happens to the person that you're looking after? So please do seek out the help and the support. And I would say, I see you even when other people don't see you. Sometimes it's even very, very difficult, especially when the person that you're taking care of is not appreciative. I was very appreciative, okay? But if the person that is dealing with you is not appreciative, it might not be that person. It might just be what they were going through that's putting them in that mood. Or it might be the kind of person you would know. You know your loved one. You know the person I'm looking after before and after. But whatever it is, just, you're doing amazing. I want most of all tell you that you're doing great looking after that person, but you also need to look after yourself. Hence why I'm emphasizing on the support for yourself. For cancer, we didn't know this before in the initial times, but in the United Kingdom, which is where we are, patients and the carers who are going through the phase of diagnosis and treatment, there were actually a lot of help. I will talk about help in a separate video, the type that we have and the type that was available, that you can access to make things a little bit bearable for yourself. Okay, so yeah, I think I would quit talking about the treatment of the surgery there. Okay, the recovery period was very long, and it was very long. Following the surgery, I'd had to do physiotherapy. Like I said, it felt like I had to learn to walk again. I was like literally walking like an old person, and by the time I was able to stand up straight again, a lot of muscles and stuff had gone, you know, like the muscle, the principle of use and disuse, whatever you don't use you lose. So I had to go through several months of physiotherapy to get my musculoskeletal system working again. Also, I needed a lot of physiotherapy to make sure that some complications does not progress, like coding, scar management. Oh my god, scars. And also, you know, the scars, when they are like that, they also affect other functions, adhesions. But thank goodness, big testimony, I did not get any of those gruesome complications. This is my testimony time, okay, so pay attention. I did not lose any of my skeletal function. Also, I wasn't really in and out of hospital because of complications, because I've heard a lot of people, I've seen it also in my line of practice, or people that went through that kind of surgery, that in and out of A&E, and that the stress, oh god, oh no. So yes, that is one of the ups. Thank God that upon on top of everything, I did not have to go through in and out of the hospitals and stuff like that. So I will be ending it here. I'll be continuing with other aspects of treatment that I've had so far, and then we'll talk about the help that we've got, both different kinds of help that we've got. And yes, the journey continues. So if you have not subscribed, click on that subscriber button and follow me through this journey, because I believe that the challenges that I'm going through, it's not just for me, it is to form a crowd of witness for people like you out there, to know that in all, God is with you in every step of the way, and he has a plan and purpose for you, just like him. In the meantime, don't forget to share. Someone you know might love this or might want to connect and share their experience, or reach out even for some sort of help. I don't know what sort of help it is, but you can share in the comment section as much as you're comfortable to do. I would be reading the comments. Okay, so that will be it for today. I will see you again next week, and I hope that your year has started the way that you're planning. If not, we are still ending the year. Hang in there. God's got you. Blessings. Bye for now.